I have a vendor partner that brings the vendor truck to the school, and we take groups of students into the truck, and they do an entire, walkthrough on how to know if an instrument needs repair and what they do in that truck. And, it's just really cool because they just walk away with, all these light bulbs going off, and they're just so excited about it because they got to go in and see it for themselves.
What if one conversation could save a life? What if one new process or new product could save a patient from surgical harm? Broadcasting from a hospital basement near you, you're listening to the Beyond Clean Canada podcast, the voice of medical device reprocessing from C to C to C. Each week, we spotlight the people, processes, and products from around the country and the world that are disrupting our profession and helping you fight dirty. Every instrument, every time. Join us as we have the kinds of conversations that matter and give our industry the kind of voice that it deserves. And now it's time to go True North strong and beyond clean.
So welcome back, Clean Freaks, to Season 3 of Beyond Clean Canada with Barry and Stacey. Today we talk with Lisa in her inspiring mission on educating SPD techs across North America. So buckle up.
From the studios of Healthcare HQ, you're listening to Beyond Clean Canada, the voice of sterile processing from C to C to C.
Welcome to another episode of the Beyond Clean Canada podcast, hosted by Stacey, Gielen, and Barry Pickrem. It's Season 3, folks, and today we have Lisa McKown, the Manager of Research and Development of Beyond Clean. And welcome, Lisa, and can you tell us a little bit about yourself?
Hey, it's great to be here. Just a little bit about myself. I've been a Manager of Research and Development for Beyond Clean for 5 years, and I've in that time worked on a series of different projects, including Microcredentials and designing other curriculum and so forth. So yeah, the other things that I've been involved in is I'm working on a double doctorate. And so looking forward to graduating this spring. So at least with the first part, with my Doctor of Public Health through Indiana University. And so then I'll be moving on to Maastricht and finishing the second half with the PhD. So
Good for you, Lisa.
Yeah, thank you.
You're welcome.
Been a long haul, but I am just so thankful for the process, personal development and everything that's coming, with publishing and, all the future work that's coming too. So
you've been very busy, Lisa.
Yeah.
Stacey and I joke around a little bit, and, I say there's busy, and then there's Lisa McKown busy. Yeah, I know you definitely wear many hats within the SPD MDR community, and, today we're only going to touch on a couple of those, and Stacey and I hope to have you back on a later episode for you to discuss more of what you're up to and how you are impacting the community.
Yeah.
And you touched on the Beyond Clean Microcredentials. You're the maker or designer of those, and I'm a graduate of the first one, the decontam, the biofilm one, and Stacey and I have had another past graduate of the microcredential on, Jesse Lopez, and we both have loved it, and we're talking about taking the quality one now, the second one that you have out. Can you discuss a little bit about, just what goes into those and, I know it's such a deep dive, like Stacey and I have talked about this before. And I said, I could give a presentation on biofilm just from taking it, you know what I mean? And It's an awesome course. And, I just want to congratulate you on that high level and that deep dive of the topic. Can you share more with our audience?
Yeah, absolutely. With microcredentialing, it's so new in our space. I had the privilege of being the very first person to create one. And so with that, I was given the liberty to explore how to approach it. And it's been a learning process for me. I really wanted to take a completely different approach to what our standard CE, is, and understand that, for competency-based education, you want to go a lot further than just taking a 10-question quiz. You really want to, initiate that active learning that's much more participative and engage in, something that's memorable, something that's going to tap into the heart and soul of why we do what we do and really connect those dots. And so when I was exploring the first one, the cross-contamination microcredential, from, a design perspective, I wanted it to utilize frameworks that were trusted. And, that was Bloom's taxonomy and Kolb's experiential learning cycle and, kind of playing with different mediums, right? So taking all these different topics that surround the topic of cross-contamination and connecting them together. So, it was from knowledge, skills, and attitudes. The attitudes are important because that's how we base our decisions. And when we're in the moment in our day-to-day workflow, we're going to remember the values that we have, and that's going to affect how we think about the choices that we have to make. Yeah. So when I went into the quality management one, when I was thinking about how to design that one, I knew I wanted to take it a little bit step further because in the quality world, a credential through, for example, the American Society on Quality, which is ASQ, their credentials are project-based. And so if a person's going to get a black belt certification, then they have to do a project that has a certain dollar value to the organization, right? And so when I was thinking about it, I wanted to also connect the dots because in other certification programs that we have for sterile processing, we might learn about some quality topics a little bit. We might be able to tell the difference between root cause analysis versus an FMEA. But our technicians don't necessarily ever get a chance to practice using those skills. And so I really wanted to make it practical where they could every single lesson was designed to build upon itself, starting from basic and then building up and giving people the fundamental skills to think about a problem that they cared about in their department, get their leadership support to work on it, and then go through the modules in a systematic way and actually provide a value end. Now, there's no dollar value tied to it. It's just that the intent is that there would be some kind of improvement that could be offered to their department because they did that project.
And actually implement it.
Absolutely. And if they didn't get to implement it in their department, for example, if they weren't able to get approval to do so, they at least went through all of the practical steps to have practiced doing it.
Right. Now, do you experience challenges, Lisa, when you are teaching adult learners? And if you do, how do you help them stay motivated?
Oh, absolutely. So, I do teaching in a lot of different settings. Mm-hmm. So, at the local level, in the classroom, I'm part of I have a program for sterile processing that is a preparatory course for certification. And so it is embedded into a adult learning career training center. And so that program, they have programs for the trades, plumbing, electrical, HVAC, heating and cooling, and so forth. And then they also have the health careers, medical assisting, pharmacy tech, and then they have sterile processing. And so that's my program. And go ahead.
Lisa, this program here, you were telling us a bit about it before. Just when you took it over and where you started with this, can you share with us and our audience just exactly where it was and where you took it?
Yeah, absolutely. Yeah. The program had existed for sterile processing in the Adult Learning Career Training Center, but it was kind of dying. And when a colleague reached out to me who I had mentored over the years, and he was changing roles and was no longer able to continue committing to teaching that class. And he had shared with me that the Adult Learning Center needed some leadership, some guidance on how to better approach teaching this content, and that there needed to be more support and things of that nature, right? And so he said, if there's anybody that could take this to the level it needs to go, it would be you.
He knows you well.
And I actually had, for my doctoral studies, the theme of apprenticeship within sterile processing was one of the things that I wanted to better explore through additional research. And so I took that as an opportunity to pilot some of my ideas embedded into this career training program. And I had those discussions with the leadership of that career training center, and I had their full support to go forward and really build this out. And so it was kind of like the same thing with the microcredential. I was given that liberty to kind of just make it what I wanted. And so when I did that, I started the very first class I was given, I had 3 students. And then each semester, we expanded that. And I want to say it was the 4th semester in. We had so many people on the wait list. It was like 150 people on the wait list.
That's awesome.
And they expanded it to 2 classrooms with a capacity of 15 each. And each semester I had an instructor that I was training, because the goal was for me not to be the teacher. It was for me to be the program developer and the leader to continue capacity building. And so I was wanting to develop these instructors so I could multiply myself, right? Mm-hmm. And so we worked on that. And so we then also, one of the first things I did is I embedded an externship program leaning on the community of stakeholders that I had. These were the sterile processing managers and so forth around the Indianapolis area where I live, and the major health systems in our area. And there's quite a few. And so then after that, I built in additional learning experiences. So taking the students early on, like in the 2nd week, to an actual hospital to do a tour of sterile processing, because many of these individuals had never stepped foot inside of a sterile processing department. And so for that, they got to connect the dots and actually see, okay, here is what we're talking about. So then throughout the semester, when we're teaching content, we can refer back to, remember when we were at the hospital and we saw this and this and this. And so then connecting it so it always makes sense. Then in addition to that, I brought in leaned on my vendor community. So lots of vendor partners, and I had some that helped donate instruments to give us an ability to actually have devices that we could put in people's hands.
It's that hands-on learning.
Yeah. Yes, absolutely. Yeah. And then in addition to that, we had some vendors come in to do, some in-services on specific topics and like a repair truck. I have a vendor partner that brings the vendor truck to the school, and we take groups of students into the truck, and they do an entire, walkthrough on how to know if an instrument needs repair and what they do in that truck. And, it's just really cool because they just walk away with, all these light bulbs going off, and they're just so excited about it because they got to go in and see it for themselves.
Well, and they're more prepared for when they actually go into the field, because you see so many students who don't do that placement, and then they only do curriculum inside the classroom. They come into the department and they run out because they're scared.
Yeah, exactly.
They're just so overwhelmed. It is an overwhelming career, field. I wouldn't say career, but it is an overwhelming field.
And it's great to see those vendors step up and support you and the community that way too,
Yeah, that's great.
Absolutely. Yeah. Well, they know too that there's a value for them in, establishing those relationships, because you think about it, the students in the classroom, someday there's going to be future supervisors there and, and managers. And, so you just never know. And, so really establishing those relationships early, is critical.
Absolutely.
And Stacey touched upon it earlier there, Lisa, with some of the challenges with the adult learning and stuff like that you encounter. I know you've got a pretty impactful back history that led you to MDR, SPD community. Can you share with Stacey and I and our audience just a little bit about that, just so they can understand a little more where you're coming from and how you got there?
Yes. So it starts back to when I was 15 years old. I had a mentor who was 45 at the time, and she was hospitalized for a very simple surgery that she just had a twisted intestine, and they were going to go in and make that correction. When she was on the table, her heart went into shock, and there was some kind of delay. It was a smaller rural hospital. I don't know what the what the issue was that was causing the delay, but by the time they got her revived, she had 5% brainwave left, and she slipped into a coma. And I was there with her in the ICU and with the family, and it's etched into the fabric of my soul what happened. And we lost her. And so I happened to marry into that family. And so she would have been my mother-in-law. And so my first daughter, I named after her. And, it was years later when I found myself in sterile processing, because I was going through, unfortunately, a divorce. And I was in life transition, and I had basically to pull up my bootstraps and be the breadwinner. I had 3 little kids, and they were completely dependent on me. I didn't have a lot of support. And so from then, when I got into sterile processing, I didn't realize immediately. It took some introspection to understand the connection. But when the OR would call, I had this sense of urgency that I didn't see in some of my peers. And I had this feeling of needing to not be ensure that I was relied on for that patient, because I didn't want anything to happen to cause a delay. I didn't want anyone else to suffer the loss of an untimely death that could have been prevented. So for me, it didn't matter if the OR needed another drape or if they needed, you know, an instrument. I made every single effort to get it to them as fast as I could.
Everything was staffed to you.
Yeah, and the quality of things, I was exceptional. I was very, very, I guess I would say I had a heightened awareness of making sure that things were right. So because of that, and being on the front line as a tech for years, and then eventually getting into leadership and continuing to struggle with the gaps that I saw in practice compared to what I knew should be the case, you know, and I just, over the years, I just had this compelling need to help be part of the solution. And so I think that is the that intrinsic drive that has propelled me. And I just want to say, you know, that my path has not been linear. It's not been easy. I had many, many setbacks and had to go through times of deep frustration that, you know, it was taking so long to get an end goal accomplished, right? But at the end of the day, it's perseverance that really matters, and staying true to that vision of why I needed to be part of the solution. And so for me, it's been, I guess, a mission, you know, that I felt I needed to do. And so I guess I just want to say, to try to encourage other people, you can't affect change unless you're willing to do something completely different. Like we can't, like, for example, when we're in a transition and we have all these barriers in our life, right? Somehow we can't assume that things are going to fall into our lap and that the change is just going to be there unless we're willing to commit to it and we're willing to
put the work in.
Exactly. Yep. And even if we have setbacks and even if we have to take some moments of rest, we still keep pushing forward.
Yep. Don't give up. Yes.
Right.
Yeah, so
that being said, Lisa, what is the most rewarding part of seeing others grow through the work that you've done?
Yeah, I would say it's when people come back to me, maybe even years later, and they say, you know, at the time, I didn't understand what you were, you know, like, I can be, maybe I'll just give you an example. When I was a newer supervisor, I had worked at a hospital that had a major staffing crisis. And I kind of stepped in when there was a lot of travelers that were kind of holding down the fort because the staff were just a very, very, most of the people that were employed there had left. And there was not a manager, and somebody from the OR had kind of been assigned to also take on sterile processing. And the fact that this was a facility that specialized in transplants and cancer patients. And so there was a lot of specialization, a lot of critical cases, people who were very, very sick. And so anyway, the inventory that was unsterile every day was so much. It was so bad that there were little cards for the days of the week that were laminated. And every day the people were putting that day's card into the trays so that they knew how many days the sets were sitting waiting to be built. That's how bad it was. Wow. And so during that time, they were hiring and hiring and hiring. And I had, as a new supervisor, I had all these brand new people that had no experience in sterile processing. And then I had the travelers. And so I had to figure out, how do I quickly get these people ready to take on the workload that's going to be expected of them when these travelers' contracts are done. And there was a date given to me of when their contracts would be done, and I was told that it would not be renewed. And so the pressure was on me to get these people ready. And so I had to lovingly prepare them. And it was one of the things I did was I took an assessment of the most challenging trays that we had in our inventory. And I set it up to where, because I was able to pull in our tracking system what the productivity of every one of our team members was. And so I knew the trays that they had touched and the ones that they had never touched. And so I had set it up to where every single week I had a plan with every single person on my team, what they were going to make sure that they focused on. And so in that example, I just want to explain that the people on my team, they weren't always appreciative of the techniques that I used. Right. But, so like during a shift, I might, I would be scanning what needed to be done. I was a working supervisor because you had to be. And I pulled a tray, a tray off of a shelf or out of the washer, and I'd stick it on someone's workstation, say, I want you to build this next. And if they needed assistance with it, I would either myself or a traveler who was experienced doing that tray next to them and say, okay, we're going to build it together, and, kind of just force the issue. And so anyway, long story short is that years later, I had some people come back to me and say, at the time we didn't really understand, but now I just want you to know how much I really deeply appreciate what you did. And I grew so much. And I've had people come back to me from the school who said, literally having a field, getting into sterile processing has changed my life. I now have been able to buy a house, and it's just, people coming back and just saying what impact it's had on them, that somebody cared, that somebody was willing to do what was hard and inspire people and motivate them and say, look, quality is not an option. When you step into the sterile processing field, you sign up for this. If you don't if you don't want that kind of pressure, you can work anywhere else.
Absolutely. And that right there is a prime example that your mission is working. Because you talked about that at the beginning of the podcast, your mission, and that right there is it. So, Lisa, thank you so much for joining us today on our first episode of season 3. We very much look forward to having you back, hearing more about the work that you do. You are an inspiration to the sterile processing field and an asset, and we are very, very much grateful for the work that you have projected out thus far, and you still have many, many more years yet to go. So thank you so much, Lisa, and we will definitely be talking to you soon.
You're so welcome, and it's my privilege. And talk soon.
Awesome. Yes, absolutely.
Thank you again for joining Stacey and Barry for another Beyond Clean Canada podcast. We appreciate your support. Keep fighting dirty.
Thanks for listening to this episode of Beyond Clean Canada, your source for MDR content, education, and inspiration. If you enjoyed this conversation, we'd love to hear from you on the BCCA LinkedIn or Facebook page, or anywhere podcasts are heard. Make sure to give us a 5-star rating on your favorite app. And until we talk again, keep fighting dirty.